Marsha Stonehill with Melt the Ice. Today on Operation F.L.O.W, I have the privilege of having a panel of nurses. Let me tell you who I have with me today. First, I will introduce you to Dr. Ernest Grant. Dr. Grant holds a Bachelor of Science in Nursing degree from North Carolina Central University and a Master's of Science in Nursing and PhD degrees from the University of North Carolina at Greensboro. He is the current president of the American Nurses Association and the first male to serve in that role in the 125-year history of the American Nurses Association. He was inducted as a fellow into the American Academy of Nursing in 2014. A distinguished leader, Dr. Ernest Grant has more than 30 years of nursing experience and is internationally recognized burn care and fire safety expert. He previously served as the Burn Outreach Coordinator for the North Carolina J.C. Burn Center at University of North Carolina Hospitals in Chapel Hill. He currently serves as adjunct faculty for the UNC Chapel Hill School of Nursing, where he works with undergraduate and graduate nursing students in the classroom and clinical settings. Dr. Grant is frequently sought out for his expertise as a clinician and educator. In addition to being a prolific speaker, he has conducted numerous burn education courses with various branches of the U.S. military in preparation for troops deployment to Iraq and Afghanistan. In 2002, President George W. Bush presented Dr. Grant with a Nurse of the Year award for his work treating burn victims from the World Trade Center site. In 2013, Dr. Grant received the B.T. Fowler Lifetime Achievement Award from the North Carolina Fire and Life Safety Education Council for making a difference in preventing the devastating effects of fire and burn injuries and deaths within the state. Next, let me introduce you to Dr. Bimbola Akintade. Dr. Bimbola Akintade earned his bachelor's, master's, and PhD degrees at the University of Maryland School of Nursing. In addition, he earned a Master's of Business Administration, and a Master's of Health Administration from the University of Maryland University College. He is an associate professor and associate dean for the master's specialties at the University of Maryland School of Nursing. Dr. Akintade is a fellow of the American Association of Nurse Practitioners and currently practices as an acute care nurse practitioner in the post-anesthesia care unit at the University of Maryland Medical Center and the trauma surgical intensive care unit at the University of Maryland Capital Region Medical Center. He is a commissioner serving with the Maryland Healthcare Commission and a pioneer board member, research committee chair, and finance committee member of the Doctors of Nursing Practice of Color. He was the founding faculty member for the Maryland chapter of the American Association of Men in Nursing and served in this role of over 6 years. Most recently, he completed the inaugural Diversity Leadership Institute cohort through the American Association of Colleges of Nursing. He serves on various editorial boards, has authored several peer-reviewed articles and book chapters, and is often an invited guest speaker. Next, let me tell you about our third panelist, Dr. Vivienne Pierce McDaniel. She earned her Doctor of Nursing practice degree from Walden University, her master's and bachelor's degrees from American Sentinel University, and her associate and applied science degree from Thomas Nelson Community College. She is an assistant professor and mentor to a Doctor of Nursing practice students at Aspen University School of Nursing and a diversity, equity, and inclusion consultant and ambassador for James Madison University. Dr. McDaniel currently serves as the Diversity, Equity, and Inclusion Chair for the Virginia Nurses Association and the Diversity, Equity, and Inclusion Ambassador for the Virginia Nurses Foundation, where she serves on the Board of Trustees. She recently completed the inaugural Diversity Leadership Institute cohort through the American Association of Colleges of Nursing and is an active member of the American Association of Colleges of Nursing Diversity, Equity, and Inclusion Group. Dr. McDaniel is a member of the Virginia State University Bachelor's of Science in Nursing Advisory Committee, a member of the Doctors of Nursing Practice of Color Anti-Racism Committee. Let me say that again. She is a member of the Doctors of Nursing Practice of Color Anti-Racism Committee and is the Vice President of the Central Virginia chapter of the National Black Nurses Association. She is also the author of several articles on diversity, equity, and inclusion. Panelists, Dr. McDaniel, Dr. Grant, Dr. Akintade, thank you so much for being with us on Operation F.L.O.W today. Please let our listeners know why you've agreed to join us here.
Well, I will let Dr. Grant go first. And by the way, please call me Vivienne.
Well, thank you very much for the opportunity to be with you today. I'm extremely excited and delighted to be here. I think we have a lot to talk about, not only about the nursing profession, but the combination of nurses and social justice as we move towards a new era in this soon-to-be and hopefully post-COVID era that we're currently in. So let's just say that we're here at the forefront, and please feel free to call me either Ernest or Ernie. So thanks.
And I feel exactly the same way as Ernest has mentioned. Also, please feel free to call me Bim. Every opportunity to speak about diversity, equity, inclusion, and social justice is an opportunity to help everyone understand, I guess the importance. And, also just I'm really excited, to be a part of this new realization that we have. We're going from cultural sensitivity now to cultural humility. And we recognize that this is not only a minority group of people's problems, but this is something that affects the entire nation. And to a certain extent, as we experienced over the last year, the world as a whole. So thanks for the opportunity. Happy to be here.
I am too excited. First of all, Marsha, in other podcasts, my cousin Michael, the son of Reverend Curtis Harris, who marched with Martin Luther King and John Lewis, told the story about bringing Martin Luther King to their home, and that his wife was so excited that she didn't give him the drink of water that he wanted when he got off of the train from the long ride from Georgia to Virginia. Well, that's how I feel right now with these two great men in nursing. I am so excited because one of my initiatives has to do with increasing the number of males in nursing. So I'm so excited that I forgot to tell you what my purpose here is. Of course, it's always about dismantling racism and improving social injustices. So I will turn it over to you and see if there's anything that you want to ask these esteemed gentlemen.
Well, thank you again, everyone, for being with us. And I'm really eager to have the uncomfortable conversations that we need to have, especially, starting within our nursing field. I would like to believe that those of us who are nurses can be the leading examples of how to have the conversations that most people run from or avoid or get extremely defensive. And as a white woman who, has, went into the nursing profession and thought that I understood a lot, it's been really eye-opening, to say the least, to realize how much I did not have proper cultural humility. And how in the last few years, or I guess since around 2012, with a lot of extensive research, I realized what is really meant by, say, white privilege. What is really meant. There's just, it's what we need to come to understand. And the more I realized within myself of what I did not understand, it was jaw-dropping. And but I believe in our profession, and I'm very grateful today to have the uncomfortable conversation with you to help set the example of how to have this conversation. So, as men in nursing and as men of color in nursing, I can't imagine what you've experienced and what you would want people to understand and how you are inviting us to grow. Would you like to speak into that at all?
Ben, would you like to go first, or?
No, please go ahead.
Okay. Well, there's as you were speaking, Marsha, there's a Black spiritual that came to mind with your last question, and it's nobody knows the trouble I've seen, and that it takes on a new meaning when you look at it from that perspective, because obviously I can talk about my experiences, but my experiences will probably, I'm sure, will be vastly different from those of Bim or any other, male of color who has chosen the nursing profession. And part of it too is, having to remember or look back and reflect back on where I came from, a little small town in the mountains of North Carolina, very rural. The time that I received my basic nursing education, and to where we are now. I definitely will say that obviously and your audience may not be able to recognize this, but I'm 6'6", so I realize that I'm a very imposing individual. And of course, being dark skinned, you have immediately, sometimes when you're walking down the hall or whatever, people immediately begin to have this instant stereotype that you're going to be hateful or hurt them, when actually I'm just as gentle as a teddy bear. You just have to get to know me. The other is being perhaps relied upon to be, back then when I went into nursing, they were just beginning to phase out the term orderly. Now we have certified nursing assistants, but back then we had men who usually probably served in the military, as medics, and once they retired or got out, they, sought jobs serving as orderly, and they were used to help lift patients or put in catheters and things of this sort. So one of the things that I had to do was to ensure to my female counterparts that I received the same education that you did. I am just as qualified as you, so I don't mind helping you to lift this person out of a chair. This is before we had lift equipment and everything else. But one of the things I would tell them is, what would you do if I wasn't here today? How would you get this person into the chair? So it's a way to get them to think otherwise, that, that I'm not just there to be your orderly, if you will, or if you had a disrupted patient, you're going to come and get me and send me into the room thinking that, that's going to calm the situation down or whatever. To think otherwise, and to get them to think that, I graduated from the same program that you did, or an equivalent. The fact that I passed the National State Board exam proves that I'm qualified to be here, so I shouldn't have to justify that I have RN after my name. It didn't matter which school of nursing that you graduated from. The fact is can you pull your weight? And in more situations than many, I more than pulled my weight. In actuality, I pretty much saved a lot of them. But that's a whole nother story. But that's just some examples of what I personally have encountered, and devised ways to politely tell my colleagues that, I'm on an equal footing with you. Let's go through this together, not just, you directing me to do this or that or whatever, but we are colleagues, which means that we're supposed to be collegial and, and face things together, not because you happen to, be white or female, that you have a superior step over me. No, I definitely was insistent on having my voice heard.
I really appreciate that you said that. And I just want to speak into, any white female that's listening to us right now, just to take a deep breath, put your defenses down, and really think about what's being said, because these are the implicit biases that we're talking about. These are the things that we're doing that we don't even realize that we're doing. And if we don't have these conversations and allow these things to be brought to our attention, the necessary social justice changes that we are all wanting, will not be able to happen.
Yes.
So
before Bim, takes up on that answer, if I could, make a couple of comments as well. I'm sure that probably every person of color, right after George Floyd's death, probably got the phone calls from their white friends saying, I didn't realize this, or how can I help, or I'm not that way, or, whatever. And I hope that they were very truthful, with their, with their white friends by saying, we've been telling you this all along, so now you get to experience it, but now let's do something about it. And so we're not asking for you to go on a guilt trip. What we're asking is that you fully open up and listen, and actively listen. That's the key word there, is to actively listen to what your Black and brown friends are telling you. And then if you don't still quite get it, repeat it back to them and say, this is what I'm hearing you say. And if they need to break it down a little bit further, then, we're happy to do that. But I truly think that, this is our time to move forward as a society and to change, the way things are. And we'll talk a little bit more about that perhaps with what is going on at ANA and the Commission to Address Racism. But I didn't want to take too much from Bim's opportunity to speak. So please.
Before you speak, Bim, I'm so glad that you said that, Ernest, because as you were talking, that's exactly what I was thinking. So I'm glad that you came back and said that.
Yeah. And I would like to emphasize in that regard, to build on what you said, that what I have observed and probably did myself, if I were to be completely honest with myself, just because it's that implicit bias. It's, you listen, but then you impose your own perspective and your own understanding without even being conscious that that's what you're doing. So it's more than listening. It's really, really absorbing what's being said and incorporating it and helping to make these things happen based on the perspective that's being shared with you, not from your own cultural perspective, if I may emphasize that.
Yeah, that's very helpful, and just, listening to Ernest. I'm sub 6 foot, so I'm not as as tall or physically imposing as you are, But my story and my experiences, just like you mentioned earlier, are quite unique. I was born to Nigerian parents, and if you've ever heard those cliches, they're true. Growing up, you only could either be a doctor, a lawyer, or an engineer, and nothing else sort of mattered. Mm-hmm. And, so I grew up, I've shared this because now, I'm at the point where, my life story should be, or I'm willing to use aspects of it as hopefully an inspiration for others. I had the worst SAT scores in my high school. So, expecting me to be a doctor was like a stretch, but, I was willing to go with it to please my parents. And with no mentorship, I came up with this plan to go through nursing school, become a nurse, and then find my way to medical school. And I'm sure many nurses have sort of this story or similar, but, that was my story. So I backed my way into nursing. It was never a passion. I never had any family members who were nurses. And now that I've been a nurse for over 20 years, looking back, that was the single most important professional decision I ever made. It's put me in a position, now to, sort of look back on some of the experiences I had along the way. So just like Ernest, most of the time I was the only male. I worked in an ICU, and that's another conversation for another day. But many minorities sort of don't work in the ICU. I mean, if we're going by statistics, which I'm a very big fan of data, so most of the time I was either the only male or the only minority person there. And every code I was on the chest doing CPR, and I was the person who you would reach out to move patients. And my reaction was a little different than Dr. Grant's, because for me, it was like, I'm going to medical school, so this just really doesn't matter, and yeah, just a really interesting and maybe somewhat immature perspective at the time of just not being able to take in the moment. The further I advanced in academia, the more grounded, I sort of became and was able to really take in my surroundings. We had a new dean at University of Maryland, and she and I went out to lunch, and she said, tell me about yourself and about your tenure in Maryland. And I said, I came here for my bachelor's and I hated it. And then I came back from my master's and I hated it. And I came back from my PhD and I really hated it. And she was like, really? And she asked why. And that's the first time anyone had asked why. And I was most of the time the only person of color in each of those classes, and probably the only male. So it's been a really interesting journey. So, when we talk about racism, we talk about sexism, for many of us, it's conflate, like there's so much going on. Now I'm a little older and I could put some of those things in perspective. And now I sort of have a better understanding of why certain things happened. At the time, I took everything in stride. I applied for something, I didn't get it, it was okay. Now I'd go back to my CV and stare at it and wonder what happened, and so you talked about implicit bias, I mean, they're just different levels, and I think for us as African-American men in nursing, there's the society's sort of impression of what the nurse should be. I remember going through my annual competencies recently, and we talked about implicit bias, and there was a very interesting chapter in there that just assumes that a nurse is a Caucasian female. Like that's the expectation, not a 6'6" African-American male. And so a lot of us have kind of gone through many of that. And so for me, I've really gone out of my way to bolster everything I've ever done. I mean, we joked about my credentials earlier, but sometimes just for me, maybe that's sort of my own implicit defense mechanism to ensure that, I'm properly represented, even if you don't meet me. First you see my name and it's African, and that brings on its own, set of preconceived notions, and sets of biases in terms of expectations ever before you get to meet me. And just like Dr. Grant, I think I'm also a reasonable, and easygoing person, so yeah, just it's been interesting, and every opportunity I get, I try as much as possible to encourage others to consider nursing and try to, as Vivienne said earlier, dismantle, just some of those preconceived notions, even though a lot of them are perception, but a lot of them are also true.
If I may inject, it sounds like to me that your conversation with the dean, it was someone who was very forward thinking. Yes. And because I'm sure that she took the words that you told her and made some changes. one of which I guess probably was to hire you on faculty. But one of the things that I have done when I have met with deans and directors of nursing programs around the country, I have told them, do this little experiment the next time you happen to be thinking about it, this conversation that we're having. When you're pulling into your parking lot or your parking spot at your School of Nursing, when you get out of your car, change your gender, change your color, and in your mind, walk into your School of Nursing and view your School of Nursing from the perspective of the person or the gender that you that you took on. So in other words, if I'm a white female, well, maybe I'm going to view it from the perspective of a Black male walking into my School of Nursing. When I look on the walls, what do I see? You're probably going to see a line of white women who were deans or associate deans or whatever. When I look at the faculty, what do I see? Probably, if it is someone who looks like me, i.e. the Black person that I am, pretending to be at this moment, are they a full professor, or do they just have the title of instructor or lecturer or maybe an assistant professor? What things do I have in place that would help that individual? And I'm not saying, giving them answers to the test or anything like that. But what I'm saying is, if you knew that this person came from a fairly poor background and they're struggling, a lot of your classes may be online or whatever, but they live in a rural part of the community where they may not have Wi-Fi. So they found that they either have to drive to a local McDonald's or supermarket parking lot to sit out there to, in order to get Wi-Fi access, or drive on into town to a library in order to do that. Why can't we give them like a hotspot or something that would, that would allow them to stay at home in the comfort of their home and learn, that way, instead of, sitting in the car and running the risk of someone coming up and, doing whatever, or reporting them because there's a Black male sitting in a car. I don't know why. He's been sitting there for like 20 minutes or so. He hasn't gotten out, hadn't gone, you see how all this begins to snowball. So, just doing little simple things like that can really sort of help to level the playing field and make it more equitable. But they probably have never thought about it from that perspective. Or ask yourself, why do minorities not want to come here? Are we not actively recruiting them? Do we go out and say to the local hospital, hey, let's start a program that, we know that a lot of people who are nursing assistants tend to be individuals of color. So why can't we start sort of a bridge program and help them, give them the resources that they need so that, again, they could either go to the local community college, or if it's a bachelor's program, help them with resources that way as well, because it's going to be beneficial all the way around. It's going to benefit the hospital, it's going to benefit the School of Nursing as well. But that's just something that just came to my mind, that we need to get deans who are willing to step out and to be, to really be leaders in embracing diversity, equity, and inclusion, and not just think of it as putting a check that, oh yeah, we have 3 Black faculty members, so, and maybe a couple of Asian faculty members, so, hey, our DEI is done. That's not DEI at all. You really need to, if that's what you think it is, then we got a long conversation we need to have.
What you were mentioning, you're talking about social determinants of education, actually. We leave that out a lot when we're discussing the social determinants of health, but those are things that are barriers to students, are barriers to people even becoming a student, So thank you so much for addressing that. Marsha, I think you were about to say something.
Well, I was just gonna, I kind of lost it, but I think what I was just going to build on is where Dr. Grant was saying, I think what you're asking us to do is not make an assumption that the position a person is in is the position that they need to stay in, that we need to create pathways that helps people to promote themselves or to get promoted and to make progress. We need to encourage people that if they want more, here's how to accomplish more.
Mm-hmm.
You know,
absolutely.
You know, it's actually a little more than that. You know, it's one thing to encourage someone to do something they've never done, or they've just never seen done. It's another thing to look up and see Dr. Grant and realize he's the first African-American president of the ANA in the 125th history of that organization, and say, you know what, I want to be the president of ANA. He's done it, you know, and so when you distill that down into something like academia, you know, and you look at a lot of universities, you know, not even at the dean level, but you go down to the associate dean or chair levels, you know, what I learned, you know, in discussion, because these are all anecdotal, right? You know, it's that, you know, when there's a position to fill, we just typically call the people we know, you know, and if mostly these positions are filled by Caucasian women, that's who they reach out to, and it creates this revolving door, you know, and not only that, you know, look at universities, you know, look at tenure faculty, associate professors and full professors, same deal, you know, and maybe not for the same reasons, but when you talk to a minority faculty member and say, you know, I think you should go for promotion, they look up and say, there's no one like me up there, you know. So I mean, and I am by no means advocating to you know, water down the process, but you know, like Dr. Grant said, we have to be very intentional about supporting, you know, this group of faculty members. It's not the same. Using myself as an example, until I actively sought mentorship, I went on a 15-year trail to med school. And I turned around and I had accomplished all these things in nursing that I didn't realize I'd accomplished until I found mentorship. And someone said, listen, you know, this is what you've done, and this is a fantastic pathway, you know, to your future career. Like, you're almost there. These are some of the experiences I have, and these are some of the things I think you can do. And from there, you know, I sort of had a better understanding of where I was, and now I could create realistic goals, you know, based on the foundations I'd created. Many minority faculty members spend their entire careers in the same position. And, you know, they derive some satisfaction from teaching and educating the future of nursing without growth.
Bim, I need to make a quick correction for you regarding, I'm the third African-American to serve as president, but the first African-American male. And I realize that I stand on the shoulders of giants, you know, those who came before me to blaze the trail. You know, were it not for people like, you know, Dr. Barbara Nichols, who was the first African-American, you know, president of ANA, and then Dr. Beverly Malone as well. And I still, you know, rely on them, you know, as, you know, to use your example, you know, they are mentors. We have, you know, a three-way conference call sometimes, you know, like almost every 3 months or so, because they are checking in on me and making sure they want me to succeed. And I, in turn, too, want to, I recognize the importance of reaching back and helping those who are coming behind in any way that I can, to be a mentor to them, you know, and help them as best as I can. And just to also add to the conversation, I didn't mean to imply that, you know, not everyone is cut out to be a nurse, just like not everybody's cut out to be, you know, a physician or a firefighter or minister or, you know, what have you. But, you know, my mentioning about the, you know, being able to help the nursing assistants or whatever, those who feel and are energized, you know, at least give them the chance, give them the opportunity. You know, and it shouldn't be that they want everything handed on a silver platter, because they're going to be in for a big surprise if they think that, because the onus is on them. Yes, we have the obligation to try to make the road a little bit easier for them, i.e. like a scholarship or maybe some mentoring or tutoring or something like that. But if they don't seem to be interested or whatever, then at some point you also perhaps need to cut your loss and say, okay, next then, if this person, if they're not showing up on time, if they're not doing the assignments that you have asked them to do, or if they're not following up with with what you have suggested, I would investigate and figure out why. But if it all indicates to me that this person just thinks that it's going to be handed to them on a silver tray, or because I write a letter of reference for them and and it's on A&A letterhead or whatever, that's going to get them where they need to be, they are totally wrong. Because I have a serious conversation with them about that because that's my reputation that's out there as well. And so I'm not going to just write a letter of reference just because we're friends. You've got to prove to me that that my sticking my reputation out there to say this person is I think would be a good qualified candidate. I'm happy to do that, but you got to earn it.
Yeah. Well, speaking of males in nursing, men in nursing, I wanted to just ask you your opinion about something, because nurses are the most trusted profession for several years now, right?
Mm-hmm.
And something that I've noticed is that we are very rarely called on by the media or by other organizations or associations to speak on behalf of anything that has to do with healthcare. I see it every now and then, but not as much as I would like to see it. And I'm wondering if you think that nurses would be more included if we were not a predominantly female profession, if we were a predominantly male profession. Do you think that we would be sought after more, or if it has anything to do with that at all?
Without a doubt. Next question. No, I fully understand where you're coming from. Part of that is, we have still have the good old boys network, and you still have a male-dominated society who tends to look back, and when they think of nursing, they do have that one stereotype that it is, it is female, and who wants to listen to a female? I mean, and I'm not saying that to sound as an insult, but it's because of the stereotype, if you will, that has been laid down in the past, that we are, as nurses, we're always subservient to the physician, that we didn't know, or we just did what the doctor ordered or whatever. But I guarantee you, every physician practicing out there, or physician's assistant practicing out there, will, if they wanted to truthfully admit it, a nurse somewhere along the way, at least once, saved their behind. I was going to say something else, but
yeah.
And sometimes more than once, okay? Because I know when I was was at the bedside, and being at an academic hospital, we'd get new residents in every 3 months. We get new residents every 3 months, new interns every 6 weeks that would rotate through the burn center. And there were those who would listen to what you would say, because you've been there, the patients, you knew what the attendings wanted and everything. And then there were those who thought that they just, they knew what they, and I'm not going to listen to you. So after a while, we would just say, okay, we'll just let you hang yourself. And sure enough, that's what they would do. And then they'd come back with their tail between the legs. We've got to realize that we have to work together. It's called a healthcare team. And nurses need to find their voice to speak up. and to say to reporters and authors and things like this that, hey, we have a voice too. We have an opinion as well. Why not ask us? We're just as knowledgeable as that physician may be, or someone else that you have sought out, because we're actually right there in the midst of it, if you will. So unless it's playing in to the heartstrings, which is when you see them perhaps wanting to either interview a nurse or show a picture of a nurse. It's somebody who like recently during the pandemic, it was nurses who are donning the gowns and gloves and stuff and going into the room, holding the patient's hands, and that's wonderful. That's what we do. That's who we are. But they fail to look at the other side to say, hey, there are nurses who are out there, in the streets as well, taking vaccine shots to people who don't have access, or nurses who are up on Capitol Hill, having discussions with members of Congress about the need to get the resources that we need to provide the care to people who've been stricken with COVID. Instead, what you got were them interviewing perhaps someone from the AMA or the American Hospital Association. And I will admit, I got quite a few of those interviews. And I will say that COVID allowed our three organizations, I wouldn't say that we were rivals, but I think we're much closer now that we have worked together, because we realize that we're all in this together, and each of us brings a unique point to this pandemic, and it's only through working together that we're going to be able to achieve the end, which is to drive down this this pandemic. Whereas before, it probably would never have happened that you would have seen the American Medical Association, the American Nurses Association, and the American Hospital Association working as closely as we have. Now, I mean, we've done that in the past, but but in this case, to do video spots together, to appear on various committees or various talk shows, that probably would not have happened prior to COVID.
Wow.
And Dr. Grant, I really appreciate your response. My perspective aligns with yours, but it also then comes from a slightly different vantage point. You ask a very good question, and it's unfortunate that in 2021 we still should be asking these questions. Mm-hmm. But if you look statistically, for the same position, same organizations, men make more money than women. Mm-hmm. In our DLI, I don't know if you remember, Vivienne, mm-hmm. there was this example one of our facilitators used about engineering. It's not only in nursing, in engineering. Yeah. A female engineer versus male engineer, the financial disparity is significant, and also sort of the opportunity to sort of lead a part. So it's part, unfortunately, of our society, and as it pertains to nursing, if there were more men in nursing, would it make a difference? I think it would, and it would for a few different reasons. I used to be the program director for the Adult Juror Acute Care NP, the DNP program at University of Maryland, and I would teach in the final semester, and I would coach my graduating students through putting their CV together and what to do during an interview and if they got an offer. And I told every one of them, I said to refuse the first offer they got. Refuse the first offer. I mean, nurses are altruistic, right? Like, I mean, we want to help. We don't want to seem like we're doing this for the money. And well, guess what? I teach healthcare finance, and healthcare is a business. I say that, people cringe, they don't like it, but healthcare is a business.
Absolutely.
It is. And so, nurses run short of something. You know what we do? We figure it out. Mm-hmm. Our physician counterparts run short of something. They report it to administration, and they would hold serve. Administration has to figure something out. I think, having nurses come to the table is just not good enough. I think having prepared nurses come to the table makes a difference. Whenever I teach healthcare finance, it's just having nurses understand healthcare finance, healthcare economics. Nurses would represent over 50% of the workforce in any healthcare institution, period. I think, having more men would help to a certain extent, but just when having nurses within our own group, one, better prepared to speak on matters that people want, that would bring us to the table, healthcare finance, how to apportion resources. The pandemic was a fantastic opportunity, also occurred last year during the Year of the Nurse. It put our profession right front and center. But just like Ernest said, it put our pictures right front and center.
Yeah.
We still didn't really get the opportunity to speak on some of the matters that we where not just first responders, we drove this ship.
Yeah.
So my perspective, once again, is a little different. Unfortunately, the simple answer to your question is yes, and that's just per society. But if we're really drilled down, I think there are many opportunities for nurses. We struggle with a lot of different priorities right now, that don't necessarily put nursing on the same page to have one voice. And that's part of the issue. If some of these bodies that should have nursing at the table sort of get the sense, it's once again an opportunity to have our physician colleagues represent, the face of healthcare in isolation. So I think we have an opportunity. Dr. Grant does his part. My little part, in the classroom and in the organizations I represent, I speak about this matter, and I challenge nurses. Don't just sit at. So when you finally get a seat at the table, then what are you going to say?
Yeah.
How do you represent nursing? Like, what's your breadth of knowledge and understanding? So that's my academic perspective.
That's a great perspective, because I think it's certainly true. It's one thing to have a seat at the table and become a yes man or a yes woman, just rubber stamping everything that they say without, because you don't want to be disruptive. You don't want to be seen as, somebody who may not be invited back. Well, I would say that, if you've got this one shot, I'm not going to miss that shot. I do need to call into question. And, like if I'm sitting on a hospital board and trying to explain to the chief financial officer that we're running short staff, and because nurses in the past have always said, okay, we'll suck it up. We'll we'll take care of 2 more patients or whatever, each, so that we don't have to call in somebody else to do overtime or whatever. But yet you look at the bottom line of the profit margin, and you see that, you could have hired, someone, to fill those positions or whatever. You've got to, get them to understand what it is that a nurse does. And just by piling on that extra 1 or 2 patients, what that is going to do to them as well. And subsequently how it's going to affect their benefits, because eventually that nurse is going to tire out and is going to be sick or have a back problem or something like that. So now you're not only down, a couple of positions, but you may be down a nurse who's out of work for, 6 weeks or so because their back is bothering them. To try to, be at the table and get them to understand that is so important. And unfortunately, we don't really think about that much, and there's an old saying that I like to use, that if you're not at the table, then you're on the menu. And that certainly is a great example of that, because they look and they say, well, who's the largest workforce that we have? It's nurses. So if we're down a couple of positions or whatever, it's okay, because you got a lot of people who can fill in for that particular person. That's not the way we want to do that. So until nurses find their voices, and one of the things that I would encourage, people such as yourself, Bim, who are in, academic settings, is to tell nurses, one, that they need to find their voice, And number two, they need to join their professional associations as well, because a lot of them, they really don't see the benefit of belonging to their professional nursing associations. And, but this is why there's strength in numbers to be able to do that and to address those issues. And then you're going to have those nurses too who don't want to be disruptive. They can't find their voice, or they're afraid to find their voice. And there's a role for them to play as well, and trying to get them to understand things. But until they finally do, then we've got to bring them along slowly. But for other nurses, getting them to be able to speak up and have their voices heard, it is so extremely important that we do that at every opportunity.
Well, Marsha, it sure sounds like suffrage still.
Yes.
We still have a lot of work to do.
Well, I'm all about empowering people and getting people to use their voice. And, I guess the psychological terms is, not being so conflict avoidant and learning again, how to put those defenses down. And just because we can't get away from people judging us or misunderstanding us. Communication is a lot of work. Mm-hmm. Emotional regulations, controlling our own emotions in the midst of that communication. It's a lot of work, so, and this is, I think within any caretaking profession, it's an interesting dynamic in that, everybody wants to help and make people feel better and doesn't want to hurt anybody, but yet avoids the very conversations that we need to have so that we can be much more powerfully effective. Mm-hmm. And I'm definitely all about advocating that level of communication that really puts things into action that we need to have move into action. We stay stuck because everybody's so afraid of what's that person going to do, or what's that person going to say, how's this going to hurt me, instead of being able to have the confidence to not internalize whatever comes at them, and be able to continue to speak their perspective, be able to consider the other person's perspective, of course, but being able to have an actual dialogue. It's not an argument, it's not a fight, it's a conversation. Goodness, I want us to move into that desperately,
Yeah, it's a long time coming, but I'll ask, do you see that we are advancing in that area? Bim and Ernest, do you see that we are advancing? Are we really getting somewhere when it comes to race relations and social justice? Are we moving the needle?
You want to go first?
Go ahead, Ernest.
Okay. Well, I would say yes, we are. It's slow. A lot of your listeners probably are aware that we have, that the American Nurses Association, along with the National Black Nurses Association, the National Association of Hispanic Nurses, and NCEMA, or National Coalition of Ethnic and Minority Nurses, we have joined together to form a national commission to address racism in nursing. And there are a number of other nursing organizations that are serving on the commission. Actually, we have a total of, I think, about 39 organizations that are, working on this initiative. And when we first got into the work, we were anticipating that perhaps we'd have a finished document by the end of the year. But as we get more and more, we're beginning to realize that, no, we want to do this and do this right. So we're not going to do a rushed thing. So we'll put out some things intermittently, and of course, with the Future of Nursing report that recently came out as well, that also further embrace the work that we are doing. We do realize we have a long way to go. And we know that a lot of organizations and associations, they're doing their own DEI work, but I think when you look at the level of the commission, it's going to be taken like the the Future of Nursing report. It's going to be the prescriptive pathway, if you will, that organizations need to follow. And one of the ways that we're trying to do this is, I think your listeners are probably familiar with ANA's scope and practice standards, because it addresses education, clinical practice, advocacy, and research. So we're taking it from that perspective because we realize that in order to change racism, it's got to start with education. It's just like we've all have heard that, a baby isn't born being, prejudiced or being racist. That's something that is taught. Well, the same thing with people who are in nursing school. You don't go into nursing school already, thinking that you know everything there is to know about nursing. It's taught. So some of the ways that professors are teaching that, or when I've heard stories from people as we've had listening sessions, that professors have used, like to people of color, like to blatantly come up to someone and to a black person and say, well, how do you fix your hair? Or how do you do this or that or whatever? That's I just shudder just thinking about that. So, we've got to change there with the idea of changing in education, that once these principles are put out there, that the NLN, the AACN, all these accrediting agencies will go to the schools and say, we've adopted these principles from the commission. Show us how you're implementing that in your educational curriculum. It will drive a change. And it will also drive a change on the NCLEX as well, because the NCLEX also sort of, in my opinion, reflects back what people are taught in school, and unfortunately sometimes a lot of that is stereotypes, and of course schools are under pressure because they feel I need to teach to the test, when the test is not really reflecting what's actually going on in real life. And then addressing the same thing in clinical practice, again, as Bim mentioned, say when a position comes open, sometimes we automatically put up those walls or think about, oh, well, who can we get to fill this position? So we're automatically doing, practicing some racist behavior, if you will, by doing that, or shutting out someone because they don't have a bachelor's degree. Maybe, why not say, you'd be great at this, if you agree to start working on your bachelor's, we'll give this to you, or do it as a trial basis or whatever, or start your own little leadership academy within your organization so that you can grow your own, who are going to be much more loyal to you than someone coming from the outside or whatever. Because usually if someone's been with you for 5 years, chances are they're going to stick around. And they see themselves as being family. So why not encourage their leadership growth instead of, looking past them to get, somebody else? And I'm not saying, don't always look outside or don't look outside your organization. Yes, it could be that there's somebody out there with some resources that you may need. But I think it's also important that you show your employees how valued they are as well by, putting them in leadership academies that would put them into eventual leadership positions as well. And the same thing with and of course, there we're hoping that the Joint Commission will adopt these principles, and then they go into, acute care facilities or other facilities that they accredit. Same thing with Magnet. Magnet is going to be doing that as well. But say we've adopted these principles, how have you put that into your clinical practice or your governance body there? So change will be coming. Same thing with advocacy, same thing with research, and we'll have leadership and administration, going through as a single thread. But it is going to take some time because, as I said, we want to get it right. We just don't want to put something out there and say, there, we've done our thing. We want this to be an ongoing thing as well that will come back and be revised in another, 2 years or 3 years after it's been put out, so that it will continue to refresh itself, so to speak.
I'm glad to know that there is that you guys are taking the initiative and that this is forthcoming, because it's a long time. Mm-hmm. And I just thought about it. Marsha, he said that there only been 3 African American presidents in the whole 125 year, did you say 125 year history? So, and I don't know about anybody else, but I'm really kind of tired of the first black this and the first black that in 2021. You know, I mean, I don't understand. I mean, I do understand. I don't know why I'm saying that, but we really need to move forward. I think that we are moving the needle a little, but I see so much more that can be done. I think about, and I won't call the name of this particular store. It's a, I'll just say it's a store that has hobby supplies. How about that? But I've gone in 2 of these stores, and they have a wall of pictures at the top in their store when you walk in that goes across the whole store. Not one African American is on that. It's among the pictures up there. Number 2, my daughter used to do commercials in New York. When we lived in New York, we went to so many auditions, and they would say things like, well, they love her voice and they will let her do radio, but they don't want a little black child. This was in the 80s. They don't want they don't want a black child to do the commercial. You know, it's like, now I'm seeing a lot of diversity, but it didn't happen until I don't know if I should, I guess I could call it an infamous murder of George Floyd. You know, I don't know. It's like, I see a lot of things happening now that I didn't see before, and that's good, but is that momentum going to continue? Is that something that is just for the moment to please a few people, or is that something that's going to continue? That's all.
We have to, I think we have to ensure that it continues. You know, we can't let the momentum slow. You know, and I can sort of agree with what you have stated before, you know, because I would tell people that, you know, every day I get probably maybe 2 or 3 solicitations for a certain level, you know, MasterCard or, you know, Black American Express card, or, you know, whatever else. And of course, we know it's based on, you know, your credit rating and your income or whatever. But every time I open up that document, you know, to look at what they're offering and things of that sort, I don't see me. Or if I do see me, I see myself in a servant role. You know, I'm not the one who's laying in the lounge chair, you know, being waited on. I'm the one who is bringing, you know, the meal or the drink to, you know, the white couple, or, you know, or whatever. You know, and I would think that if you really wanted my business, because you already know who I am, you already, you know, I mean, looking, the mere fact that you're sending me this offer knows that you know that I have a certain income. You know that that I'm a male. You should know that I'm a Black male. You should know that you know, based on my zip code, you know, the economics and everything else. I mean, you know more about me, and et cetera. So if you truly wanted me to use your card, or to, you know, to accept your offer, then I would think that you would really want to get to know me and say, hey, this is okay, let's change this around a little bit, because I know they do that. You know, they have, you know, different ways of advertising to, you know, the same card, or maybe a lesser version of the card to, you know, to different ethnicities. But it's just, all it takes is just a little bit more effort to say that, you know, hey, if we want to go after, you know, this particular population or whatever, then, you know, let's change our way a little bit, whether you're being honest or not about it or not. You know, the thing is, you know, they wind up in the shredder, because again, if I open it up and I don't see me, it's like, you know, you've already lost me there already. Yeah.
I do the same. I do the very same. And that goes for any advertisement. If it's on TV and I don't see any people of color, I tend to not, you know, buy the product.
Buy the product, yeah.
Yeah, I just think it's crazy that we are still dealing with this in 2021.
I want to build off of what you just said there. I don't know that we I don't know that we have ever dealt with it in a direct manner. We've had emotional reactions, and and then you get those spurts of it, right? Now after the George Floyd incident, there's all this diversity, equity, and inclusivity motion, but how deeply authentic is it? And until we can have the conversations that people are actually quite cynical about still, let's be really honest, there's still a lot of work to do, because there's a lot of cynicism. There's still a lot of, when are we ever going to stop talking about this? Why do we have to keep talking about this? And what are we going to do next? Oh my gosh, I can't say anything anymore, because if I say anything, then it's biased now, or I'm a racist, And so, again, until people can tap into some confidence inside themselves and put their defenses down and be able to have conversations that are avoided by way too many people, and honestly, if people, it's about learning how to communicate, in my opinion. I've often said, I don't know how we're ever going to talk about these issues until we learn how to talk to each other. Because I know inside family systems, or inside even just the closest relationships that people have with each other, they have difficulty, with conflict resolution or solving differences about what to eat for dinner. That becomes an argument, right? So much less talking about race or sexism or, these other levels of needs. So I really want to advocate for that. We do need to continue to push forward. We do need to continue to set the example of how to have the conversations that people are afraid to have. And just keep encouraging people to learn from those conversations, to recognize that we're unpacking a lot. We're unpacking so much. I mean, there's so many different directions. As I'm listening to each of you speak, there's just so many different layers of directions that we could take, and have about 5 more panels at least of the conversation that we've had today, right? There's a lot to it. And I want to believe, again, that the nursing profession is an avenue that we can use to set the stage and set the example of here's how we do these conversations.
Marsha, you actually touch on a couple of very important points. I mean, Vivienne just, mentioned, the needle moving, and I think Ernest has done a fantastic job talking about, all these necessary organizations, accreditation bodies, coming together, because at the end of the day, I mean, the most important way to combat systemic racism is changing policy. We can talk for as long as we want. If we don't put some teeth behind what we talk about, then it's just nice conversations that make us feel better at the moment. But the existing policies, still remain. So big kudos to AACN for the diversity leadership program we just completed. It's programs like that provide intentional opportunities for individuals to learn, to build more, skills, your knowledge, your attitudes, have toolboxes of information, to go be change agents in individual organizations. I'll be honest with you. I mean, no one wants what happened with George Floyd, but it took DEI as that initiative that we, have faculty or members of an organization who are sort of self-governing. It put those issues at the forefront, and it's forcing organizations, whether they like it or not, to invest time, resources, and money into DEI initiatives. I'm a hopeless optimist, I guess, and on this matter. I don't think it's something that can go away. I think the conversation is started. And now that the conversation is started, the most important thing is, as you've mentioned earlier, Marsha, is, just for individuals to let down their guard and start to learn to understand, having these conversations, just sort of getting a better understanding. A lot of our experiences are very unique, but at the same time, we're all impacted. I mean, I can speak to academia, from admissions to progressions. I mean, we see it. We see these policies that don't favor certain students. And now more than ever, we recognize that there's a problem, so knowing how to have these conversations, that doesn't come naturally. No one wants to talk about this, but it impacts all of us and not in a nice way, so I think just having the opportunity to learn a little more, some historical perspectives, how some of these policies came to be, and just having some influential organizations. I mean, I think it was the Yale School of Nursing that came out with a position very shortly after the George Floyd incident, about how they were going to weave DEI into their entire program. I mean, we need forerunners, to come out and set the stage, and people like Ernest, who lead these, national and international organizations to create blueprints and pathways for the rest of us to follow.
I agree. And also, we need to change the textbooks that we are using to teach nursing. Mm-hmm. So that's a whole different story. That's a whole different podcast. And because of respect of time, what I'm going to say is that, Marsha, I think just like all of the other guests that you've had, we are going to have to invite them back. And we will talk specifically about social justice or social injustice, really, and about racism in not just in nursing, but period. I think we will have to do that. But I want to respect both of you, your time, and actually all three of you. And I just hope that you will come back again, Marsha.
Absolutely. Thank each of you so much for this conversation. And I have no doubt that it'll be fruitful for listeners to drink this in and put a lot of thought into it. And I certainly hope that you'll come back to Operation F.L.O.W and do several parts. We're setting the stage and the example to give people a modeling of how to have these conversations. So please do come back in the future. Are there any just one-liners that you want to put out there as we wrap up, as far as something that you would like people to take away from today?
Well, for me, first of all, thank you for the invitation. And yes, I'll be happy to come back on and do a part 2 or 3 or 4 of this dialogue. I think probably if I just reflect back over everything that I've said, I think the most important takeaway that I would like for your listeners to have is the part where I stress that they actively listen to their colleagues. It's so important that we, don't be so quick to draw or to jump to conclusions, that you actually listen and then ask for clarification if you're not certain about things. That will start the change momentum right there.
And same for me. Thank you very much for this opportunity. I mean, it's been a pleasure for me. And as Ernest said, I'll come back as many times as you need me to. My one-liner and takeaway, which is something I've preached and advocated for, is having nurses at the decision-making table, and not just having them there, but having them prepared. Yes. Just nothing speaks better about our profession than people who are passionate, and people who are also prepared for the moment. So any opportunity you get, I've been teased a lot about my credentials, but each one of those things have served a purpose, and they continue to. If you have the opportunity to learn and to invest in building your own knowledge, please take advantage of it. Nurses are more than individuals that take care of patients at the bedside. You know, we're leaders in our own right, and we're probably the most versatile, you know, occupation, professional occupation, period. So please, you know, think diverse, and don't only think it, but act upon it.
All I have to say is, you know me, good trouble. I always have to leave with Congressman John Lewis's good trouble. We have to get into good trouble.
Amen.
But I really appreciate both of you coming and chatting with us. I'm still excited about it. And so we will definitely reach out to you.